Danielle?
Yes.
Hi, my name's Casey. I'm going to be your nurse today.
Okay.
Can I have you identify your name and your date of birth for me real quick?
Danielle, and September 24th, 1993.
Perfect. So I'm here to give you your postpartum assessment. I'm just going to wash my hands, put on some gloves. When we go through it, just go ahead and any questions you have, go ahead and ask me. I'm going to try to let you know what's kind of going on with your body, what's normal, what's not, so that way you're more comfortable with what's going on, because I know it's a lot.
Oh, yeah, sure.
All right. So we're going to start off with some vital signs, so I'm going to get those real quick. All right, everything looks great. So next we're going to start with your breasts. So I'm going to go ahead and undo your gown here.
Oh, okay.
All right, so I'm going to palpate your breasts here, checking for any tenderness, firmness, checking the contour as well if I'm noting any shininess, which I'm not, which is good.
All right.
As far as your nipples, I'm just checking to see if they're dry or cracked, and then for any redness, they look good. Are they sore or tender at all?
No.
No? Good. If you do start to get uncomfortable there, we have some linoleum cream we can apply to you.
Okay.
And that should help alleviate that, but you said you're doing okay for now?
Yes.
All right. And you are breastfeeding, correct?
Yes.
Okay, so make sure you know you're wearing a nice supported bra.
Okay.
Okay. They do make nursing bras, they're great. As well as if you do start to feel yourself becoming gorged, go ahead and either, you're going to want to feed the baby then, or you're going to want to pump, or you want to apply a warm towel and then go ahead and try to feed, and that might alleviate some discomfort, okay?
Okay, yeah.
All right. Have you gone to the bathroom recently?
Yes.
Good. How often have you been going?
About every 2 hours.
About every 2 hours? Awesome. Do you know how much you've been going by chance?
About 150.
Perfect. Awesome. That's exactly what we want. So you want to make sure you're going every 2 hours with that number at 150 to prevent any bladder distension, okay?
Okay.
And since you did go, right now we're going to assess your fundus to see if it's firm or boggy.
Okay.
Before, I'm going to have you do it too. But before you do this, you always want to go to the bathroom. Like I said, you want to make sure that bladder is not distended. Otherwise, it can throw our results off a little bit.
Okay.
I'm going to do here. So we're going to support the uterus. Okay, as well as feeling here to make sure it's nice and firm.
Okay.
Okay, so I'm going to have you do it too. You are nice and firm, so I want you to know what that feels like.
Okay.
Okay, so anything not as firm as that, or, not as tight, that's going to be considered boggy. So you're kind of going to do what you were just doing. Massage it up a little bit. Feel it start to become more firm. And
Okay.
you will. It's crazy how it works. Okay, so when you do that, you might notice you're passing a few small nickel to diazine clots. That's
Okay.
going to be normal for the first few days. So I'm going to actually go ahead and assess your lochia while we're down here.
Okay.
Okay, so for the first 3 days, you're going to have what we call rubra. That's going to be bright red.
Okay.
So you might start to notice that. Like I said, you might notice some small clots, nickel to dime size. If you do notice they start to get larger or more excessive, or if you're noticing you're soaking a pad in an hour or more, like one pad an hour,
Yes.
that's something you need to let us know right away, and we need to further evaluate, okay?
Okay.
Okay. So by day 4 to 10, you're going to notice that it starts to get a little more watery or seriously. So that's known as serosa. And about day 10 to 14, you're going to notice it's going to thin out, become colorless now, and that's known as alba.
Okay.
By this point, if you do notice some kind of odor, I'm going to have you come back in and get you checked out, because there shouldn't be an odor that might be indicating an infection, okay?
Okay.
Right? So as far as bowel movements, I know you had the episiotomy, so I know that can be scary and you don't want to strain so hard. Have you had a bowel movement yet?
No.
You haven't? Okay. So your doctor did prescribe you Colace PRN, which is a stool softener that will make sure we get to you, because we want to make sure you're going regularly, as well as making sure you're increasing your water and juices. Okay. And then on your trays, I know it's not everybody's favorite, but we want to make sure we're making some fruit and some vegetable choices to get some fiber in there, okay?
Oh, okay.
And then any chance you get, if you want to get up and start walking, that's going to help everything get to moving, and it'll make going a lot less stressful for you, okay? All right, next I want to go ahead and assess that episiotomy.
Okay.
So what I'm going to want to do is I'm going to have you turn, but when you turn, I want you to keep this leg straight from me, and I want you to bend this knee, okay?
Oh, yeah, no problem.
Perfect. Nice and easy. Oh, look at you. You're a champ. All right. So I'm just checking for any redness, edema, ecchymosis, making sure it's not approximated or no drainage. Everything looks good. How is the pain back here? Just a little bit?
Yes.
Yeah. Okay, so we can get you some Tylenol for that, as well as we have the benzocaine spray,
Okay.
as well as ice pads and tucks that we'll make sure we get for you.
Okay.
Have you been using the Peri bottle?
Yes.
Yes, and you know from front to back?
Yes.
And how do you wipe?
Oh, from front to back.
Perfect. We want to make sure we're keeping all that bacteria out of that incision, okay?
Okay.
Okay? We want to prevent an infection. Next, I'm going to check your legs down here.
Okay.
So what I'm going to do, I'm going to pull these back. All right, so I'm just going to have you here and go forward. Any pain?
No.
All right. How about with this one?
No.
No? Then I'm going to check for any redness,
Okay.
warmth, swelling, no pain again?
No.
No? All right, perfect. So, new mama, everything looks good. How are you feeling? How is it?
Doing great. Yeah.
Good. How is it being a new mama? You love it?
It's exciting. Yeah.
It is?
It's very exciting.
So, right now, I know you're feeling good, but, you know, you just had a baby, so your body went through a lot.
Okay.
So, your hormones are going to be fluctuating, so, you know what, you might be crying over little stuff. Your emotions are going to be all over the place.
All right.
For the first 2 weeks, that's normal. Now, once we start getting past that second week, then that's where, you know, we want you to come back in and get reevaluated if you're feeling still down or you don't feel attached to your baby or anything like that. We'll pay attention to that with you, now, but doesn't look like there's anything to worry about right now.
Okay.
So, everything actually does look really well. Is there any questions that you have for me or anything I can go over with you?
No, I think you covered everything.
Good. So I'm going to go ahead then, and I want to make sure that your call light is near you.
Okay.
And just as a reminder, when you're getting up to go to the bathroom, you're calling us still, right?
Okay, yeah.
Yeah, you better be. We don't want you falling over anything. Just for the first few times, we know you're doing great.
Okay.
You are doing great, so I don't have any problems. But so make sure you're calling us, as well as if you are in the bathroom, try not to lock the door. I know you want your privacy, but in case anything happens to you, want to be able to get in there right away, okay?
Okay, no problem.
All right, anything? Are you sure I can't get you anything else?
No, perfect. Thank you.
All right, thank you so much.